The official statistic, Dr. Fauci, is that 80,000 Americans have died from the pandemic. There are some epidemiologists who suggest the number may be 50% higher than that. What do you think?
I'm not sure, Senator Sanders, if it's going to be 50% higher, but most of us feel that the number of deaths are likely higher than that number because given the situation, particularly in New York City, when they were really strapped with a very serious challenge to their healthcare system, that there may have been people who died at home who did have COVID, who were not counted as COVID because they never really got to the hospital. So in direct answer to your question, I think you are correct that the number is likely higher. I don't know exactly what percent higher, but almost certainly it's higher.
Dr. Anthony Fauci testifying yesterday. Meanwhile, a model from the University of Washington is now projecting 147,000 deaths in the United States by August 4th. That's 10,000 more deaths than the model's last prediction. A senior administration official tells NBC News that while they keep an eye on these outside models, the administration largely focuses on its own data, CDC guidelines, and guidance from the coronavirus task force. Joining us now, the governor of Rhode Island, Democrat, Gina Raimondo. Very good to have you.
Mika, you got the party right.
I know. Right. You guys keep going back to that. So, Gina, great to see you, Governor. I know that you're working hard to work with businesses and tech companies to get testing and tracing in place in your state. But what happens between then and now? Then, when all of that is in place, and now when the economy is at the standstill and people are frustrated and worried about their economic security?
Yeah. So good morning. Good to see you guys. You know, the story of how Rhode Island is getting through this crisis is really one of innovation. So exactly as you said, I don't think any of us, certainly I have never had to lead through anything quite like this, which means we have to move fast and also think differently. And so what I have tried to do is reach out and ask for partnerships. We partnered immediately with CVS, hometown company here, to ramp up our testing. We now have some of the highest testing per capita in America. Reached out to Salesforce very early in the crisis and said, hey, you guys have to help me develop a best-in-class contact tracing system, and reached out to Amazon Web Services. We are flooded with unemployment insurance claims like every state in the country. I had people hanging on hold or busy signals, which is exactly what they shouldn't be doing during the crisis. And now we're able to process 1,000 calls a minute. So, you know, my point in saying this is every day is different. We have to be quick and react, but we have to be open to innovating and doing things differently. Because as you said, we do have to get people back to work. You know, we have to do it safely. We have to do it thoughtfully. We have to do it slowly. But my focus has been flatten our curve, which we've done very successfully through taking aggressive and swift action, and then build systems, testing systems, contact tracing systems, symptom tracking systems, so people have confidence and feel safe so that we can slowly get folks back to work. Because, you know, we have an economic crisis here as well as a public health crisis. And when you're the governor, I've got 1 million people I need to answer to. They need to be both safe and healthy and slowly getting back to work with confidence.
Governor, what about the bigger picture, though? Because as Rhode Island stands out in your ability to develop these partnerships and get testing and tracing in place and proper distancing guidelines met by the people. And as you work to, as you said, we got to get the economy back going, work to do that. What about the fact that you're just one state and a lot of people move through your state? It's kind of, doesn't it defeat the purpose if other states aren't on the same page?
Well, first, I want to give a shout out to my fellow governors in this region. They are all battling this every day and doing a terrific job of that. About 3 weeks ago, we came together, 7 governors in the Northeast, to collaborate and coordinate our efforts around reopening, including travel, as you say, and that including joint purchasing of PPE, again, constantly innovating, doing things differently to meet the challenge. So that's going to be critical. You know, Rhode Island is a small state nestled between two huge hotspots of the crisis, to the north, Boston, to the south, New York City. So we have had to deal with that fact, and I'm really quite pleased with where we are now. I was able to lift our stay-at-home order just the other day, but you're absolutely right. I mean, I'm in constant contact with fellow governors, and we're working together to protect our region and our regional economy.
Governor, it's Willie Geist. Good to have you with us this morning. You mentioned that slow reopening that you started over the weekend. Some restaurants will be able to have outdoor dining, some retail with restrictions, of course. How are you weighing this balance that every governor and every municipality is having to look at right now of wanting to get your people back to work, wanting to get your small businesses open, and the public health questions that come with reopening your society? Obviously, from the federal government, the push from the President of the United States is let's open, let's transition to greatness, to use his Twitter term. We've got to get back to work. How are you looking at it as a governor who actually has to manage those 1 million people in your state?
Yeah, thank you, Willie. You know, look, it's tough. Everything is a judgment call, and the governors are absolutely on the front lines. I'm living in my state on the ground. I hear from people every day, and the stories of economic struggle are real. You know, I hear from restaurant owners who worry they may not be able to reopen. They can't sustain 2 or 3 months of no business. Having said that, I'll tell you how I'm dealing with it. I really believe in this slow and steady reopening. My goal, of course, is to reopen once. You know, you don't want to go too fast and then have to pull back and reopen again. So the approach that I've landed on after great consultation with public health experts, my team, businesses, is, guys, it's in everyone's interest to go slowly and steadily. Let's take 14 days, let's study where we are for 14 days, and then take the next step. I'm confident. I'm leading with confidence. I trust the people of Rhode Island that they're going to do the right thing. They know it's in their interest to follow the rules so they can reopen. But I never again want to have to pull back and shut down our economy. So we've landed in a place of slowly reopening, you know, like the dimmer switch, not the flick of a light, and hoping that if you do that slowly, you never have to pull back. And I think people get it. Listen, they're frustrated, and I get that too. But we are where we are, and I think we just have to accept it.
Governor Gina Raimondo, thank you very much for coming on the show. We wish you the best of luck with this. Thank you.
Thank you so much, Governor.
Thanks, guys.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.